If you're looking to improve your health long term and you want to know where to start with one simple thing, I'm going to share that in today's episode. Hi everyone, welcome back to the Sports Performance Podcast. Welcome all new listeners and welcome back to those who have heard our content in the past. Before we go on to today's episode, what is the latest and greatest at sports performance? Now, I promised myself I wouldn't get emotional. One of the things that we're celebrating whenever you're listening to this is October of 2024. We celebrated a birthday. 10 years of sports performance, being in business, helping the communities of Chula, Vista, San Diego, and Kearney Mesa. It's been an absolute blessing for those who have been in our world or have been clients in the past or you've rooted for us from afar. I just wanted to personally say thank you. For those of you who don't know, my wife and I, we started this business to be able to do one thing, was to deliver world-class customer service and get people world-class outcomes. I had traveled all over the world with pro athletes. I worked for the United States Olympic Committee, and I worked with pro tennis players. And I traveled the world, and ultimately my goal was to be able to bring that to my community because I saw there wasn't the care that I felt was what they needed. And so that concept spread, and it all started with one customer, one client, and his name was John, and it just turns into he told his mom, and that neighbor they told their neighbor, and just kind of spread. And so along this journey, we've been able to meet and help incredible amounts of people. I think we've seen somewhere over 15 people from 15 different countries, over I think 20 different states that have flown in and been part of the recovery process. So for that, we thank you, and we're excited to go on to the next 10 years. So it's been amazing. I can truly just say thank you throughout this whole process. We never thought in a million years we'd be where we are today, and we're very grateful, and we never forget that. So thank you for rooting for us. Other than that, things have been great. We're going into the holidays. We're really excited to launch a couple of different programs and promotions for all our customers. But ultimately, I wanted to share a couple things that we've been seeing trends with a lot of our clients and how this can help you in your everyday fitness. And one of the things that we've noticed is that there's one simple thing that you could be doing to improve your health, and it has nothing to do with exercise. It has nothing to do with going to the gym or hiking or running or any of those things. And this came off a conversation with a client who had recently done one of our hyperbaric oxygen therapy sessions. And one of my big fascinations as I age, at the ripe age of 42 years old, I am obsessed with trying to live as long as possible. For those of you who know, I have 3 kids. I have a 3-year-old, a 6-year-old, and an 8-year-old. And a couple years ago, I had a big epiphany on my lifespan and my health span. For those of you who don't know, lifespan is a number of years that you're alive, and your health span is the quality within that. So maybe if you were 90 years old, but you couldn't walk, you couldn't, maybe you had Alzheimer's, and your ability to enjoy your life at the rate that you were previously is decreased drastically. They call that a shortened health span. So in order to help increase your health span, both cognitive and your physical, the big goal here is to figure out how do we do that. And there's a lot of things and a lot of research that shows that you can, and I'm going to share one important one that you can do to increase your health span, and I'm obsessed with this. And so everything that we're doing at SP is really targeted towards this for people like myself, like yourself, that maybe you're 25 years old or maybe you're 70 years old. We're all trying to do the same thing, enjoy life, but also have the greatest health along that ride. So we look at hyperbaric oxygen. For those you know, probably over the last year we introduced it, and we've got a lot of great results from people who've said, it's benefited them. And one of the things that we've tracked to see people's progress inside the hyperbaric oxygen therapy is their resting heart rate. And let me describe what the resting heart rate is and what this means for you. So resting heart rate, you might be going around your daily activities. You go to the grocery store, you go into work, you go up and down stairs, and you can maybe feel your heart, right? It's pumping. Now that's your heart working throughout the day, and you're sitting, you're standing. Your resting heart rate is what is your heart doing maybe when you're asleep. Let's imagine it's midnight. You've been asleep since 7 p.m. because we all know that's realistic for a lot of us. You've had 3 or 4 hours of sleep, and you're in the deepest sleep possible, and you're horizontal. You got no stress. Now, in theory, your heart shouldn't be beating very quickly. Why? Because your body's at rest, and now your heart just needs to be able to pump to keep your body in a stable state. Now, if you have a low resting heart rate, that means you have a strong heart in general. Meaning, if you are still and lying down and you have a resting heart rate of 40 beats per minute or 35 beats per minute, meaning your heart just needs to pump a few times a minute to be able to keep you and your body healthy. Now, an unhealthy range would be somewhere in the world of 70, 80, 90 beats per minute. And now you might say, well, what's normal? Now, there's different graphs and those type of things to help you understand this, but in the age of people in their 20s, they're going to be about 40 beats per minute. If you're in your 30s, it gets exponentially tougher to keep a resting heart rate. So in your 30s, you might see resting heart rates in the 50s and so on as you go forward. So, but the question is, how do you improve your resting heart rate? Now, improving your resting heart rate is very proportional to how much you exercise in aerobic training, meaning if you run quite a bit, if you row quite a bit, if you jog quite a bit. Now, if you do resistance training, that's not aerobic work. You're not really challenging your lungs or your heart, so it's not associated with just a lower resting heart rate. So weight training and going to the gym is fitness. Now, what we're trying to do is, what do you do aerobically where you challenge your lungs and your heart to really get more fit? And that's what lowers your resting heart rate. So a few years ago, when I lost 52 pounds in 52 weeks, one of the things that I noticed was I started to see my resting heart rate drop. I got to a point where I was in, I think, 36 or 38 beats per minute at the age of 40, which is a very tough thing to do. And the biggest thing that I saw was I increased my activity level and I started running more and doing those type of things, but I also slept more. I was averaging about 5 hours of sleep a night, and basically my body was working. When you don't sleep a lot, your body doesn't get to rest or recover. So it's in recovery mode, and what you're now doing is you're triggering your heart to work just a little bit harder because it can't relax. So it's now going to have a higher resting heart rate. So when I slept more, my resting heart rate helped drop it even more so. So one of the things that as I've researched is, how does hyperbaric oxygen therapy help my resting heart rate? And so ultimately, one of the things that we've seen is as you get more oxygen into your system, it allows you to recover faster. Your heart doesn't have to work so hard. You have a better engine, a little bit more fluid. And so as we've seen people lower their resting heart rate with hyperbaric oxygen therapy, now we've started to see, well, how do we help our clients determine or help figure out or point them in the right direction of what's a good resting heart rate for them? And if they've never seen this ever before, educate them so they can start to see, how do we increase our health? How do we increase our health span? And so one of the first things to do now that you're trying to maximize everything that you do in your health, maybe you have new shoes, you're working with a personal trainer, you're eating healthy, you're no longer in pain, you came to see the team at Sports Performance, you're no longer in pain, good for you. The question is, what's next, right? And that's always the question that we get. So if you're looking to determine what's the next thing I should be looking at, maybe you've had your blood work, you've had your bone density done. One of the things I'm going to point you to is your resting heart rate. You need to look at where you are in your ranges, and I'm going to let you look that up on a graph, and you can find those very quickly on Google on what norm is for your age group and your activity level and those things. But one of the things that we want to encourage our clients to do, and when you walk into Sports Performance, our team should be pushing you in this direction because it's a big theme of the customers that we're seeing and how we can help people. And now you might say, well, I want to just fix my knee pain. I want to fix my back pain. The reality is that you hurt your back or your knee trying to accomplish a general fitness activity. You were at the gym, you were on a run, you were going up and down stairs, you were taking care of your kids, and that limited you from doing that. So while we're going to fix the knee pain and back pain, we're also kind of trying to do is get you back to that fitness level and beyond. And the way we're going to measure that is by obviously getting rid of your pain, but then also what's your resting heart rate at? And then how low can we truly get this? And you might say, why is that so important, Chris? Because it's important to your health. If you've done your blood work, if you've done your heart rate and you've tracked these things, it helps to show you, it's kind of a dial. Am I going too fast, too hard? Am I going too slow? Now, for somebody who enjoys going to the gym and doing weights, that's fantastic. Your resting heart rate might not go up as much. But if you really want to improve your cardiovascular condition and increase your health span and your lifespan, including some type of cardiovascular fitness is going to be the best thing for you. Now, after losing 52 pounds in 52 weeks, lowering my resting heart rate, I'm the most fit I've ever been. I've done the blood work. I've done doctor's appointments, and the way you feel great about yourself is not just the way your genes fit or what the scale says, but it's also what your heart and your body is telling you. So what might look good on the mirror might not feel good inside. And so if you're really looking at improving your confidence and feeling good about yourself, I encourage you, continue to exercise the way you want, do everything that you're currently doing. I just need you to start tracking one thing, and that's your resting heart rate. So great. How do I track my resting heart rate? One of the easiest things to do is purchase a wearable. And what I mean by that is those who have an Apple Watch or a Samsung watch, or maybe you have something called an Oura Ring. There's various things out there. There's a Fitbit. I know you've probably heard of that. And ultimately, all of these things have them. And you can go down a rabbit hole of which one is best and which one's more accurate. Ultimately, if you've never done this before, I would encourage you to just get started. Buy the cheapest one out there. Put it on your wrist, put it on your hand, and track the data. And you say, okay, so now what do I do with the data? I would try and get at least 3 months or 6 months of data that shows you trends. So your body initially, you might say, oh my goodness, my resting heart rate is 65. Is that a good thing? Ultimately, what we're trying to do is have improvements on that. So all we're going to ask you to do is for a month, 2 months, and 3 months is to see where your resting heart rate changes. If you're staying at 65 and you're trying to improve your health, lowering your resting heart rate is a good indicator. So maybe you're not challenging your body enough. And as we've done this over the last 3 to 6 months with the clients at Sports Performance, we've seen they've been surprised. They had no idea they weren't exercising at the rate or the type of exercise that they needed to increase their health. And that's probably been the biggest, eye-opening thing for us, is that people had no idea that this was so critical. So now we're bringing that to our clients. So if you're interested, we'd love to be able to just help you with your data, interpret that. You can email us at teamsp@sportsperformancept.com. Ultimately, we're just trying to help the public understand, what good health is, and not having to rely on, the gym or your doctor telling you what your blood pressure is and all these other things. There's just one more simpler thing that to help you understand where you are. So if you're having a resting heart rate of 70 or more, that is a yellow flag for us. We really need to help you understand how to get that back down. If you have a resting heart rate of anything below 40, that is incredible, especially if you're over 40 years old. If you're over 50 and have a resting heart rate of under 40, you are absolutely crushing it. Keep going. We'd love to be able to just support you and root for you as well. So if you're interested, we'd love to have share your data. But now, have the wearable on, track that, share it with other people. Some people love the accountability, they love a challenge. What's your resting heart rate? Well, mine is this. Fun fact, my wife Stephanie, if you guys have ever seen her in the clinic, she got a notification in the last couple weeks. She hit a 34 or 35 as her resting heart rate, and the watch woke her up in the middle of the night saying, this is not normal, you're having a medical emergency. And all she was doing was sleeping. And she does really well with aerobic type of training, and she loves cardiovascular training. So kudos to her for having that low of a heart rate. I wish I will get there someday, and we want to be able to help you too. So if you're interested in maximizing your health and not just the aches and pains. You want to take it one more notch level. One of the things we're working on at the moment is our ultimate health program. We're really trying to help people go above those aches and pains, go above their personal training or their fitness, go above the stretching and mechanics and all these other things. And for those of you who are searching just like myself to be able to go to that next level, that's kind of the next thing that we're working on. So if you're interested in working with us in these early phases, we'd love to be part of it. Send us your data. We help you interpret that. So we'd be excited to do that. If you want to be part of that, you can email us at teamsp@sportsperformancept.com. I'd love to personally be able to help you with that as well. So hope you guys are doing fantastic, living your best life, your healthiest life, and a life with the lowest resting heart rate. So we'll take care, and we'll see you guys on the next episode. Take care. Hi, if you found this video helpful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for my weekly tips on improving your lifelong health without aches and pains. Thanks, and I'll see you soon.